The hospital transformation process starts now. In a sweeping effort to save Vermont hospitals from bankruptcy, a consultant commissioned by Vermont's healthcare regulators has put out a report with recommendations that's been met with resistance from hospitals across the state. Our Laura Ullman has been following the story.
Now that the report's been released, it's time for implementation. That process will be led by Vermont's Agency of Human Services.
This has real impacts on affordability for, the basic necessities of life.
Brendan Krause is the Director of Healthcare Reform at Vermont's Agency of Human Services. He's spearheading the hospital transformation and sustainability implementation project within the department.
Embedded in local communities that support primary care, that provide care coordination for people with multiple chronic conditions, that help to navigate other social services for people who are experiencing health-related social needs.
And outside of it,
this is an opportunity for us to really sit down with these hospitals and listen to their concerns and listen to their goals and support them.
Right now, the Agency of Human Services is in conversation with hospital CEOs around the state about what recommendations can be implemented from the report and which ones could be too risky.
This is like a hurricane. It's predictable within certain limits. You can see it coming. You can plan for it.
Dr. Hamry from consulting firm Oliver Wyman conducted hundreds of interviews, over a dozen public meetings, and several investigations into Vermont's healthcare system and hospital finances. His top recommendations to keep hospitals open, healthcare accessible and affordable, are to build housing, move to reference-based pricing, and move care out of hospitals.
There's always a bad person. And that's what consultants get paid to do sometimes, is to deliver news that people don't want to hear. As those costs go up and you can't afford to keep increasing the number of dollars you give, you have to change the way the care is delivered.
Each hospital has its own set of recommendations, which can be found on our website at WCAX.com. Whether or not they will be implemented is up to each nonprofit's administration.
So you're saying if these recommendations are not acted upon, we could be facing hospital closures across the state?
Yes.
The Agency of Human Services says some hospitals are already implementing the recommendations on their own, but Hamry says as of now, he's not seeing much improvement.
Budget submissions that were just sent to the Green Mountain Care Board and the budget's approved, those trends are not changing.
The next step for the Agency of Human Services is to select a consultant to help with the implementation process. The agency has received a round of bids and say they will choose that person within the next 6 weeks. In the studio, Laura Ullman, Channel 3 News.